Good morning. My name's James Stanger. I'm an embryologist with more than 50 years' experience in IVF, and I'm creating these short takes for Ferdate's YouTube channel to provide a bridge between the information being published and the information that clients need to take to their doctor. There's more than 2,000 articles published on IVF each year in a large number of different journals, many of which are not accessible both to staff and to clients, and many are quite difficult to read and require some previous awareness. The aim of these short takes is to create this bridge whereby the information can be summarised and distilled into a format that patients attending for IVF treatment can hopefully be able to generate questions to ask their doctor. I'm not a medical doctor, and this is not medical advice. And basically, it's a summary of information being presented by scientific people elsewhere. This particular talk relates to male partner age and how it affects your chance of miscarriage after IVF. The data was being presented at the ESTRA meeting in Europe and has not yet been published. So let's look at the summary. This appears on the Patient Education Trust website, and I'll present the URL for your access in the information section. So the summary basically says IVF cycles are more likely to end in miscarriage when the male partner is over 45, according to research presented at the 41st annual meeting of the European Society for Human Reproduction and Embryology, ESTRA, in Paris. By looking at donor egg cycles where all the eggs came from young women, the researchers were able to exclude the female partner's age as a factor to highlight the effect of male age. They found that when the male partner is aged over 45, the miscarriage rate is higher and the live birth rate is lower compared to cycles where the male partner is younger. Traditionally, maternal age has always been the central focus in reproductive medicine, but the author's results suggest that the age of the male partner may also play a crucial and independent role. The researchers analysed results from the first cycle for over 1,700 IVF attempts using donor eggs from 6 clinics in Italy and Spain. Dividing these two groups based on maternal age, they found that the fertilisation rate and embryo development outcomes were similar across both groups. However, when looking at pregnancy outcomes, there was a difference. In the over 45 group, the miscarriage rate was about 24% versus about 16% for those aged 45 or younger. The chair of ESTRA said this draws attention to a much overlooked factor in the IVF field. The results presented should be seriously considered during the counselling process for couples where the male partner is over 45. Professor Pacey, who was not involved in the study, also told BioNews, this study serves to remind us that male age has a marked influence in outcomes, such as miscarriage. It's one of the reasons why most clinics don't recruit sperm donors older than 45 is because the outcomes are poorer and there is a measurable impact on health outcomes for any child born to older donors. The author suggested that DNA replication errors in sperm production could accumulate with age, as well as fragmentation of sperm DNA and epigenetic changes. So I'd just like to stop here and go to a summary of maternal age and ART produced in my IVF study website. The results are kind of the same, but kind of different. In one study, the AR, the aneuploidy rate, that is where the aneuploidy is where the embryo's got the wrong number of chromosomes and almost destined to fail to implant. In most cases, the aneuploidy rate's about less than 50% until the age of 44, when the aneuploidy rate is about 90%. So in other words, men who are old 45 and older produce far more embryos that are abnormal. And this is one reason why you see these embryos miscarrying. However, in some studies, when they're looking at the man's age, after correcting for the woman's age, there was actually no difference in the rate of aneuploidy. So a lot of the aneuploidy that you see for men that are older than 45 is because the female partner is also older, where the rate of aneuploidy is largely due to the eggs rather than sperm. In the study we've just been talking about, because they used eggs from donors, where they're mainly very young, the rate of aneuploidy is a little lower, but it's still quite significant, still in the order of around just under 50%. So there is a suggestion that when you look at embryos and you test them due genetic testing and look for the number of chromosomes, whether they are the right number or not, paternal age significantly impacts the rate at which there are abnormal embryos. So the summary of this article then is that if you are attending IVF and your partner is more than 45, which won't be very many, but then you may like to discuss this with your doctor. And one way that you can address this to some extent is that when you make embryos, they can be tested during genetic analysis called PGTA. However, just because you may have the right number of chromosomes, there may still be errors in the chromosomes associated with age, what's called epigenetic errors, that the PGTA may not pick up. So even though you may have your embryos tested and found that they are euploidy or the right number of chromosomes, you can't rule out that some embryos will still carry mutations that will cause miscarriage, and that's one of the consequences of using IVF where the man is over 45. If it becomes severe, or if the female also has low numbers of oocytes, the ultimate decision would be whether you would use your husband's sperm or partner's sperm, or use donor sperm where they are of a younger age. I think we'll stop there, and call quits. Thank you.